Welcome to BHB's Perspectives podcast. I'm Laura Lovett, Senior Editor at Behavioral Health Business. In this podcast, I'm sitting down with John Driscoll, CEO of substance use disorder provider Caron. We'll be talking about the future of substance use disorder care, including treating the condition as a brain disease, the rise of intermediate care, and using preventative measures in care. Hi, John. Thank you so much for coming on.
Thank you. It's my pleasure to be here.
Let's start with one of these big questions. What are the big shifts changing addiction care today?
It's a big question. I wish I had a simple, clear answer, but there's a lot of moving pieces today in the world. Everything from regulations to how insurance companies are understanding the explosion in costs and trying to control those. To changes in regulations, even with ASAM criteria being updated, and some of the states adapt to that. Some of them are changing. Some of them are caught in between. So there's a lot of movement today in the shifts of addiction care. I like to try to focus on some of the areas that are in the realm of what Caron is trying to do. And a lot of that is really trying to shift the industry to treat addiction and mental health like the brain disease that it is. And so it's an exciting time to be in the industry. And there's a lot of changes on a lot of levels happening that I'd be willing to go in whatever direction it is that you'd find most interesting.
Yeah, I know you've talked a lot about substance use disorder being a brain disease and really looking at that element. Could you talk to me a little bit more about that and how you kind of view that at Caron?
Sure. So when we talk about the brain disease, just like with traditional healthcare, we treat the organ of the disease. We treat the organ of the affliction. And with addiction and mental health, it should be no different. The technology has advanced today. Our ability to understand the chemicals that impact the brain, the electricity that impacts the brain, and most importantly, the blood flow that occurs in the brain. The technology is advanced with other disorders that impact the brain, and they're utilizing them today. Yet today, our industry, addiction and mental health treatment providers, haven't kept pace, haven't stayed up with those. And so I think that's an area that we really need to delve into. When we use mood-altering chemicals, we're basically assaulting the brain. I mean, that's where the rush is coming from. There's neurotransmitters that are firing, the dopamine, the serotonin, that are impacting those pleasure centers of our brain. What are we doing to assess that? Okay, we do typical social chemical assessments that talk about how the person's life has been impacted, but why aren't we doing the other medical impacts to say what's occurring with the blood flow, what's occurring with the chemical loads that we have, what's happening to the neurotransmitters when we go to assess it, so that we get a baseline of where is this occurring, what's happened. And even with somebody that overdoses, okay, that's ataxia. The brain and the whole body is being deprived of oxygen. What occurs there? And so then when we talk about treatment and recovery and healing, why aren't we measuring those? We would be doing that if it was a heart disease, if it was a lung disease. This is my biggest push for us at Caron and in the field in general, to say we won the battle of parity. We are part of healthcare. We need to start acting like it.
Yeah, no, I think that's so interesting. I mean, I think one of the really interesting things about Caron is the research that you do. And I think that kind of feeds into what you were just saying too. I mean, are you seeing any new exciting research in that space?
Well, research under the official term takes a long time to get done. When you look at universal studies and even here as we were doing research, which we all found out about during COVID, of what it takes to understand what's occurring and move it into research-backed treatment, takes a long time. And so we're trying to speed that up by doing smaller studies, some case assessments, and really begin to partner with the others in the academic world to say, let's begin looking at how this is impacting us. One of the articles that came out recently dealing with PTSD in Israel following the invasion that they had, using hyperbaric oxygen therapy to help treat people with PTSD. And some of the criticism that they got, because they're saying, well, where's the evidence to back this up? And I'm paraphrasing here. Their response back was something to the effect of, we're seeing the clinical benefit of it today. We're going to start utilizing it because we have patients in jeopardy today. So let's start using it, and we'll allow some of the research to follow it right now. And so I think that's somewhat of the exciting time that we're in with our industry, is let's begin to show this. Let's begin to measure it. And that's my whole point here is, don't just pay attention to say, is there evidence or not, is let's begin the process. Let's start taking, these lab levels. Let's get the cortisol level in the beginning. Let's get the cortisol level throughout. Yet let's utilize measurement-based treatment, not just with a Likert scale, but with these exams, with these blood tests. We've known insurance has reimbursed us and other payers have reimbursed us for utilizing urine drug screening tests to see if the alcohol and drugs are present in a system. Why can't we do that with neurochemicals, electrons, and do scans that give us objective data, not just patient-reported data?
Yeah, no, that makes so much sense. It's really interesting. And something we'll definitely be keeping an eye out for. Kind of looking at the operations side, we've seen a big movement towards more PHPs or partial hospitalization programs and intensive outpatient programs, including at Caron. What is the future of intermediate care, and could that make residential care extinct?
Yeah, so great question there. And so let me say this in a couple of ways. I think the reason why you're seeing a move towards PHP and other, as you termed it, intermediate care, is because we are trying to adapt to healthcare, where we want precision-based medicine. We don't just want a one-size-fits-all, where everybody, regardless of the level, suddenly you need 28 days of residential treatment. I've been in the industry for 35 years. 30 years ago, the insurance industry pushed back hard to say, why does everybody coming in need exactly 28 days of treatment? And they had a legitimate point. And so what you're seeing today is those treatment providers beginning to make the shift and say, it's the old adage, if the only tool you have is a hammer, everything looks like a nail. Well, if all you have is residential treatment and it's only 28 days and everybody gets the exact same program, well, then that's going to be the course of treatment we have. So what you're seeing here is actually the treatment industry's move to say, we want to individualize care. We want to really dial it in to where an individual is at and provide them the right treatment for the right level, for the right length of time. And if you think about this is no different than anything else. Cancer treatment years ago, what do? Well, we just have to cut it all out. Or we just had to radiate this large area, and there was lots of other tissue and organs damaged as a result of it. Where today the field is advanced, where they've got radiology and even chemical treatments that really pinpoint the individual cells. That's the type of evidence-based advancement they've done in healthcare. And you're just seeing that beginning to happen. And we say, we're seeing all these different types of therapy coming, because that's what we need to do to progress towards the individualization of treatment. So overall, I think it's a good thing. Does residential care go away? No. We still need people in the hospitals. You and I believe talked about this before when it came to heart treatment. They invented stents to help open up arteries that didn't require open heart surgery. Did that mean the cardiologists went out of business? Did that mean that we shut down the surgery centers and nobody ever had open heart surgery before? No, it didn't. What it meant was we were able to access care earlier, more effectively, more affordably, and help millions of people across the country instead of a few 100,000 that had access to that type of surgery and those types of resources to do it. So I think that's what you're seeing a result of here more and more than some type of business case of, well, this isn't good anymore and we've got to shift here. Is I think you're seeing a broadening of the field as it should be.
No, that makes a lot of sense. Are there any service lines that are kind of flying under the radar right now, but could use more attention?
Yeah. So again, I think like all of these, you know, the words I use all the time is the best way to treat a chronic disease is to prevent the chronic disease. And so, there's prevention materials, but then there's also things that we need to do early detection, early understanding of, am I beginning to cause a problem? And so a lot of that is education. A lot of that is looking for it in areas that aren't necessarily alcohol and drug treatment centers. It's looking at it in primary care. It's being a part of the screening assessment. And you see that today. I was just recently in for a local history and physical at my local provider, and I got a mental health questionnaire asking me. So they're screening. They're looking for signs of depression. They're not coming right out and saying, are you depressed? But they're saying, are you having difficulty sleeping? Do you see sudden weight loss or weight gain? Are you experiencing periods of inability to sleep, restlessness, racing heart? So they're screening and they're getting education out there. That's what we need to do more of on the addiction side. Is you're drinking more than you thought it was? Do you find yourself not remembering how many you had? Do you find yourself drinking earlier in the day? Do you find yourself using illicit substances? Do you find has anybody talked to you about their concern about how much you consume or what you look like when you consume? That's how we get this broader net out there, is that we all have brains. We're all human. Just like we do with other screening tools for healthcare, we need to do the same thing with mental health and addiction. And by doing that then allows people to begin to access care earlier. They don't need to come straight into a residential treatment plan center. Maybe it's outpatient therapy. Maybe it's peer assisted therapy. Maybe it's simple, hey, here's education. The best way to deal with obesity. Now, maybe if you're several hundred pounds overweight, you need to go see a physician and follow a plan. But maybe you just need to watch a YouTube channel and teach yourself how to exercise and eat better and move in that direction. So that's what we're trying to do, is build out this entire spectrum of how we address addiction and mental health. And you've seen it happen even with the terming, moving away from mental health to mental well-being.
I think the prevention space is so interesting. So I think it's really interesting you brought that up. I guess my question on prevention is, are there challenges around reimbursement and then also those handoffs? Because I've heard a lot where PCPs are like, yes, we know we should be doing this, but where do we send folks? And can there be partnerships there? Like, what could that look like for the future of prevention?
Yeah, absolutely. And I do think it is about partnerships. And I think it is bigger and broader than just expecting a payer relationship to do so. It's a different business model. You're impacting people at a different realm of where they're at. And so I wouldn't necessarily expect the insurance company to say, oh, this is going to be a part of what we pay for. As I said, a lot of this is around education. A lot of this is around awareness. A lot of this is living a healthy, fulfilling lifestyle that spans, your entire life, not just a couple of years, but literally the decades that you're alive. So I do think it involves a broader array of partnerships of people working together on this march to help all people try to live, the most realized, actuated, active, fulfilling life that a person can possibly experience.
Yeah. Something we've been hearing a lot about in health is the consumerization of health. I used to cover digital health, and I feel like that was a real big buzzword, but maybe it hasn't come into substance use disorder care as much. But I'm wondering, have you seen, that consumerization of healthcare really come into that space at all? And how are you thinking about it?
Oh, yes, absolutely. I would say it is certainly there. For those that, let me categorize it like this. For those that are aware and accepting that they have a chemical use disorder, there's consumerism in there where they're shopping around and they're looking for this or that, especially if they've experienced treatment in one modality or another. They're out there looking for it. But let's not forget that the biggest barrier that we have, and this is government SAMHSA reported information, is people's denial or inability to accept that this is actually a disease. That this is a problem that they're having. And we've known this for decades in the field as a denial of their use, of their quantity, of the impact on their life is the number one indicator. And today, that continues to be the largest barrier to getting people care, especially early on, because it's much easier to sort of wave it away and be like, oh, that's not that big of a deal. That's just, it's a college student. That's a teenager. If you think about it, what they've done, and again, I like to draw these parallels between traditional healthcare. Skin cancer is all the rage out there right now. People are looking at it, paying attention to it. And they're giving you simple educations. Yeah, people have moles, people have specks, people have things. But take a look at it. Pay attention to it. Did it grow? Did it move? Do you see more of them? Did it appear somewhat different? That's not saying that you have skin cancer, but it's telling you to pay attention and be aware of these types of signs and symptoms. And if you see them, go in and see a specialist. That's what I'm talking about when it comes to prevention. Many people in this country, in this world, can consume alcohol without a problem. They're social drinkers. In the industry, there's a backhand joke about it's alcohol abuse. How can they only have a half a glass of wine? Why would they stop there? So it's one of those things that if that's what you have, a half a glass of wine occasionally, yeah, do we need all these interventions? You probably don't, but you want to pay attention to that. If that half a glass becomes a full glass, if that once or twice a month becomes once or twice a week, if we start consuming more, if we start shifting into other chemicals, that's where we want to start paying attention to, hey, is there something else going on here? And let's be on the lookout for, is this going to develop into a full-fledged disease? And how early do I want to get in and begin the process of preventing it?
Yeah, no, that makes a lot of sense. Do you see the patient population changing for you at all? And how do you cater to each group that is coming to you?
Yeah, so I do see a change in the population. Now, some of that is an impact of both what Caron is doing as we're shifting to be an in-network insurance provider, moving away from just being purely a self-pay organization. The cost of care is extremely high for all healthcare. I mean, if you go to a hospital today without health insurance, you're getting a big bill regardless of what the disease is. Same thing with addiction and mental health. So it's important that we help people have access to world-class treatment and utilize their health insurance that they pay a lot of money for too as well. So let's be most effective and efficient with that. So as a result of that, what we're seeing is people need to make sure that disease or disorder is being covered by their insurance, which means that you need to have evidence that shows there's a problem. So people aren't necessarily coming in after this is the first issue I have. If you go in and see a dermatologist for a skin assessment and there's nothing showing, and then suddenly you see another bump and you're like, oh, I want to go in again, and I want to go in again, I want to go in again. They're probably not going to say that yes, we're going to keep covering these quick little things. We want you to be able to really give us some clinical evidence that we really think there's a problem here instead of the normal aging process. So I think there's that balance that we've got to have between what is truly a medical issue that needs to be assessed and covered, and what is that is just sort of a normal course of treatment or life. So we are seeing people wait longer to come into care. So we're seeing a higher acuity, more complexity. Rarely are we seeing people come in with just alcohol use. There's usually other chemicals that have come on board, whether it's prescription medications or illicit or recently legalized, such as marijuana. So we are seeing that shift occur as time goes on here. Some of it is we're getting towards the top of the spectrum of people seeking treatment. And then some of it is just simply to get your insurance to pay for it. You need to show evidence that you actually have this disorder.
Yeah, and the addiction treatment market is becoming increasingly crowded, and then there's new players in there. There's digital players, different types of treatment. How is Caron differentiating itself among that market?
Yeah, so we're doing both, and we're differentiating ourselves and we're joining that market. We do believe, 70 years ago we were a residential treatment center. That's what we did. People came to us, and so we got the people that needed time away from society. As you hear me talk about prevention, early intervention, long-term ongoing care, we need to be shifting the modality of that. So Caron is joining the virtual revolution, the outpatient revolution, the technology, the coaching, the app revolution that's shown to work really well for other chronic disorders and diseases of disease management. And that's really what we're doing. So we're joining that industry, and it's booming right now. And AI is going to fuel that considerably because it's no longer requiring on their input to then get some type of machine assessment back. AI is going to be able to scan all this information and provide, whether it's written contact or eventually virtual contact back to somebody to help them manage the long-term effects of their disease. So Caron is there. We're working with researchers. We're trying new technology. We're implementing things. All of our patients, all of our families get introduced to our connection apps that allow them to have these resources at their fingertips any place that they're at. So that's a big piece of it. Where we're currently differentiating ourselves is we seem to be the loudest voice out there in the wilderness saying, treat this as a brain disorder. Let's do more than just the social assessment here. Let's look at some of the brain scans. Let's look at some of the objective medical data and measure the impact of the treatment modalities that we're doing along the way. If we give somebody 30 days of services, let's look at what their brain looks like at the beginning of those 30 days, middle 30 days, and end of 30 days to say, are these therapeutic interventions that we're utilizing having the healing process on the brain that we would expect to occur?
You talked a little bit about technology. How do you think about technology in the future? What's the most exciting? Where do you see the biggest opportunities? And also, are there any dangers with, we talk a lot about AI. So what should we be thinking about in that space?
Right now, I'm for all of it. If we can get more than 10 to 15% of the people that have this disorder to be aware of it and begin treating it, I'm for that right now. Okay, I'm the move the chains type of person. I'm not I need a home run on every type of thing. I need it to get better. So right now, any and all of this entering the field that raises awareness, that raises access, that gives people the ability to utilize any type of services is better than them simply being out there suffering and not knowing. Let's worry about, is this the right one or the wrong one? When we get 70, 80% of the people with disease getting care and treatment of where they need to be. So right now, there's just such a big gap of those that need treatment and those that are getting it. Let's get anything that advances the ball there. Then let's talk about, where is the future going to be? If we talk about this, maybe 10% of the population have this disorder, and you just simply do math on that. So we're talking 30 to 40 million people. Well, there's not enough treatment beds or treatment chairs in the entire country to begin to address that big of a need. So we're going to have to find a better way to deliver services. And which means we got to get better at assessing. We got to get better at creating services. AI seems like it's going to be a tool that's going to help us extend our ability, extend our professionals to allow them to do more with less, to great efficiencies. So we're at the infancy of this. I would say grab it and run with it because there's more of a danger of doing less than of doing more.
Yeah, I think that's so interesting. And it does seem like there is a lot of enthusiasm around AI and new technologies. So we'll see that, behavioral health has historically sort of been behind with some of these. And so I think it'd be interesting and exciting for behavioral health to sort of be at the forefront, hopefully. In the future.
And AI isn't just for the treatment modalities. It's also a great resource to help us. The addiction and mental health field is a really person-heavy resource. These are people that are doing it, and their time is valuable. And a big part of our job is doing the documentation that's necessary to make sure that we can clearly articulate the person's condition and get that submitted and reimbursed for care. I mean, you need to be able to document these things. AI is going to have a tremendous impact on our ability to really allow the counselors to spend most of their time with the patients and really reduce that amount of documentation, because it can become more effective and efficient. Whether it's using AI ambient listening, whether it's using AI to help us with proper documentation and cueing us as to make sure you include this or make sure you include that, or even taking the document, submitting it through, getting the bill, and collecting the charges. From a business operations standpoint, it can really help us reduce costs that aren't necessarily essential to the care that the person receives, but more essential to the justification of the reimbursement, the actual reimbursement, and the clinical operations that need to go on. So I think that's a great opportunity for us, especially in an industry today where we're saying our costs are going up, we need to be reimbursed more. So we're looking at a revenue solution. Well, there's also an expense solution. How can I do more with less on the expense side? And that's where we're using Aura AI as part of our electronic medical record to help our clinicians work smarter, work more efficiently, work with the help of AI so that they have more time with more patients, and we're actually able to reduce costs and provide better care.
Yeah. So really on that operational side of things. What's next for Caron? What are you looking forward? What are you looking forward to? What's next for the organization?
Sure. So we just launched a 3-year strategic plan, and we've got 5 simple focus areas. Number 1 is we're looking to serve more people. You heard me say there's millions of people out there without care. Caron has been blessed with resources, tremendous employees. We need to help more people. It's what our founders started us on nearly 70 years ago. We need to do that. Caron's also looking to continue to push the edge of innovation and outcomes of patient care. So this whole piece of treating the brain, assessing the brain, utilizing technology and advancement, that's our big second focused area. The third focused area is we're still going to be people. AI might come in, but we're a people business. And it's making Caron a place people love to work. It's so important that we bring in good employees and then we retain them and give them a place to stay, and strive about the organization they look in. On top of that, we need to be a financially sustainable organization. We've got to be able to balance our revenue with our expenses. And we're not a for-profit. We are a non-profit organization. But it doesn't mean that we lose money. It means that we've got to be smart. We've got to make a little bit of a margin to continue to reinvest. And then the fifth focus area that we have is really about transforming the field. We need the field to follow us into really addressing the organ of the affliction. And that's everybody. That's mental health. That's addiction treatment centers. It's ASAM. It's ABAM. It's the psychiatrist. It's the regulators and the policymakers and the payers. Let us continue to advance the treatment of this chronic disease because we are a part of healthcare. Healthcare continues to advance. Stop paying us for what we did in the past and help us begin to pay for what we need to do in the future as we move forward in treating these disorders.
Thank you so much, John. This was great. I feel like I learned a lot today, and it's always just a pleasure to sit down with you and talk about the future of addiction care.
Well, thank you. And it's always my pleasure to speak with you. I enjoy these conversations. And I want to thank you for helping us get my and Caron's message out about the need for the field to transform and the need to help more people access this care. Because even though it is a chronic deadly disease, it is very much a treatable disease. Good treatment works.
Thank you for listening to this episode of BHB's Perspectives Podcast. I'm Laura Levitt with WTWH Media. See you next time.